Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So in the last class, actually, we are discussing about the attention and attention-seeking behavior in children. So today we will come to the actual topic, that is attention deficit hyperreactivity disorders, or it is also called as ADHD. And today we will see the basics of ADHD. Now, ADHD is considered under the disruptive behavioral disorders and also neurodevelopmental disorders. So this is considered under the problem which is related to behavioral disorders and also neurodevelopmental disorders. So basically this is a developmental problem also, and this is also a behavioral problem also. Now previously, before 1980, this disease is called as hyperkinetic reaction of the child. Before 1980s, this is called as a hyperkinetic reaction of the childhood. But after 1980, the new name is given, nomenclature has been given, that is ADHD. Okay, so ADHD is nothing but poorly controlled, impulsive, acting out behavior where the self-control is expected. When some self-control is expected in children regarding certain activities. Now this control is poorly controlled. It is poorly controlled, and the action of the child is very impulsive and acting out, and also there is shifting of the attention. We have got attention deficit. In the previous class we have discussed about the attention. Child is not able to attentive. Child is not attentive. He is not able to attend one particular task at a time. Okay, so he frequently shifts from one task to another task. So there is a problem in attention. And in the meantime, there is also impulsiveness, there is also acting out behavior, and there is no self-control on the activities. So that totally leads to the formation of attention deficit hyperreactivity disorders. So significant impairment in the functioning in at least two settings. Now before labeling any condition as ADHD, it should be seen that similar type of activity will be seen in two settings. One is, for example, home setting and school setting, or home setting or clinic setting. Okay, sometimes maybe because of one particular environment, baby may show this type of activities. To rule out such possibilities, so we have to check the baby in two different setup, like home and school and home and clinic, or home and some others home, etc. So if it is present in such a two settings, then you can call it as ADHD due to impulsivity, inattention, and hyperreactivity. So the three things are very important. One is attention deficit, therefore there is inattention. Another one is there is hyperactivity. Another one is there is impulsivity, at once, doing at once. Okay, so these three things are very important. Now, when we see the ADHD, some of the familial pattern is also seen. Usually we will get the family history actually sometime. And this is quite common in children between 3 to 13 years of age. This is quite common in the children between 3 to 13 years of the age. Now, in ADHD, actually we have got three important types. So understanding this is very important. Clinical setting, when we come to ADHD, we cannot get all the three in a child. Suppose a child is there with the ADHD. Sometimes inattention, hyperactivity, and impulsivity. These things are important. Sometimes you may get inattention only. Hyperreactivity is not so much. And impulsivity is there. Sometimes impulsivity is not there. Hyperactivity and as well as inattention is there. Sometimes only inattention will be there. Other two will not be there. So we need to actually identify these things. Okay. So because treatment will going to differ accordingly. So there are three types. One is combined type, most common. This is most common, where we find all the three: hyperreactivity, inattention, and impulsivity. All the three are seen, and this is most common. And difficulty in attention and also focus, and some may show hyperreactive impulse behavior also. This is common in combined type. Inattentive type. Here the problem is attention is not there. Okay, this is the second most common type. And this usually also sometimes confuses with the autism, like that in the initial part. Inattention type. Second most common, and difficulty with the attention is there, and there is no significantly hyperreactive or impulsive behavior. So impulsive behavior, if you see, there is no much seen, but hyperreactivity is also not much seen. But child is not able to attentive. Child is not able to give attention to particular aspect. So he cannot concentrate. He cannot give attention. Usually he shifts from one topic to another topic. Okay, so that's the second type. And third type is hyperreactivity impulsivity type. That means there is no problem with the attention. Attention is proper. And there is no much difficulty in attention, but child is more hyperreactive and impulsive, and is more common in the preschoolers. Many times it is to some extent physiological also. Preschoolers, 3, 4, 5 years, 3, 4 years. So this is quite common. Okay, 55 to 95% of the monozygotic twins will have this problem. It is seen that about 55 to 95% of the monozygotic twins will have this particular problem. The reason is not known again. So like that, ADHD can be basically divided into 3 types. One is hyperreactivity impulsive type, another one is inattentive type, and another one is combined type. Now, age-wise behavioral disorders in the children. Now, we cannot say that all the hyperactivities which is happening in the child is ADHD or hyperreactive disorder. There are so many other behavioral disorders also there, and that can also get confused with the ADHD. For example, infancy. In the infancy period, first year of the life, so there is resistance to feeding, and sometimes there is abdominal colic, and sometimes there is stranger anxiety. These are the common behavioral things which happens, and because of this also child may be little hyperactive, and that may confuse with the ADHD, but it is not so. Resistance to feeding will be always there, tongue thrust will be there, and resistant feeding will be always there. Then abdominal colic, because of abdominal colic, baby do the vigorous activities, baby is not able to concentrate on particular thing, baby is frequently crying, and then stranger anxiety. So this has to be identified. Similarly, in the childhood period, temper tantrum will be there, thumb sucking will be there, enuresis is common, then pica is common, speech problems are common, tics are commonly seen, then breath holding spells are seen, nail biting is seen, encopresis may be seen, sleep disorders may be seen. Okay, so these are some of the behavioral problems that we can see in the childhood period. Similarly, in the adolescence period also we have got some of the behavioral problems, masturbation like activities, juvenile delinquency, that is antisocial activities and all. So these are some of the behavioral problems age-wise when we see, because where I'm telling is ADHD is also one of the behavioral problem and also neurological, but it is also behavioral. Okay. Now, there are some of the genetic problems which are associated with the ADHD. We should also know this. Some of the genetic problems are also there, where we find ADHD very commonly. For example, Klinefelter syndrome. Klinefelter syndrome is basically associated with the antisocial activities. Okay, so a child when he is going to the school, you have got a lot of complaints from the teacher that he is doing so many antisocial activities in the school. Okay, he is beating somebody, he is harming somebody, he is throwing something like that. So Klinefelter syndrome usually we will have the symptoms of ADHD. Then Turner syndrome also we can find certain ADHD-like features. Fragile X syndrome, okay, a second most common cause of mental retardation. There also we can see the ADHD-like activities. Neurofibromatosis type 1, there also we can see that. Williams syndrome, then DiGeorge syndrome. So these are some of the syndromes where we can find ADHD as a symptom. Now, if you see the incidence of ADHD, the boys are, it's common in boys compared to the girls. Compared to the girls, the boys are more commonly get affected. A child with ADHD, and usually we will get about 25% chance of parents are also having it, the family history, 25% chance. In a child with ADHD, if you take the family history, the parents or the near relatives, Dadaji, Nanaji, etc. So usually we will have the history of ADHD in them also. Then ADHD and environmental risk factors, and that is very important. The ADHD, Satmya Jabhava, what we say in Ayurveda. So how the environment is there and environmental risk factors. So in which particular environment child has been brought up. So that also contribute a lot for the development of ADHD. You have a pleasant environment, cool environment, and everybody is giving the attention. In contrary, there is an aggressive environment around, and nobody is giving the attention, nobody is taking care of the child. So chance of ADHD will going to increase. Then low socio-economical status, it is always one of the most common cause for all the problems. Then parental mental disorders. The parents, mother and father is suffering from some of the mental problems. Yes, child is also expected to have such problems, and ADHD-like behavior may develop. Foster care or caretaker, mother is not taking the care, father is not taking the care, somebody is taking the care. So there also child may develop into ADHD. Then one more important thing is child with a low birth weight and prematurity, the chance of ADHD is more. Chance of ADHD is more. Yes, low birth because of the immaturity of the brain in a proper way, and the white matter may not develop properly. Usually in the low birth and prematurity, the white matter problems are commonly seen around the hypothalamic area and all. Okay, so now leukemia, yes, the leukemia which is seen. Now, acquired traumatic brain injury, any type of brain injury which occurs maybe in the fetal life, maybe during the time of the delivery, or rather afterwards, may also precipitate for a chance of ADHD. Nicotine exposure during the pregnancy. If the mother is exposed to nicotine during the pregnancy, like cigarette smoking and some other tobacco, etc., so then also the chance of incidence is more. And mother with infection of the mumps. A mother infected with the mumps during the pregnancy has also shown the increased incidence of ADHD thereafter. Then measles, herpes zoster during the pregnancy, and some other enteroviruses entering inside and causing the problem. So all such viral infections have shown the greater incidence of ADHD in the child in the later part of the life. Now, one very important thing we have to understand is ADHD is nothing related with the style of parenting or discipline. So many times parents are blamed for this. If the child develops the ADHD, and elders in the home and even the friends, they blame the parents. You have not taken care of your child properly, therefore the child is developing this. Actually, this type of blame is unnecessary, because actually parental care is not much to do with the ADHD. It is because of the brain programming the things are taking place. Of course, this brain programming get affected by so many triggering factors, but we should not make responsible the parents only, because for lifetime, if you make them responsible for this particular ADHD, then throughout the life their guilty feeling will be there. So this has happened because of us. Actually, there is a very less relationship with the parental discipline and all those things. So this may continue in adults also, in 30 to 50% of the cases. In an adult, it is presented as coping skill which compensate some of or all other impairment. ADHD, there is a problem in the attention, there is problem in concentration, there is problem in doing one particular work, and there is also some hyperreactive behavior. So when the same occurs in the adults, actually as a child is, as adult can able to copy others, isn't it? If he is doing wrong now, or suppose his position is wrong, his activity is wrong, then he can look at others and he can copy others and he can correct it. Okay, this is quite impossible in children, but in adults it's possible. So what happens in adults, the ADHD is not much focused, or it's not much seen, because usually an adult, although he is ADHD, he tried to copy others and he learned how to correct himself, and his impairments will be not focused, he will correct it. So people with ADHD will have more likely to have a problem with the social skills. So usually people with ADHD, they will have the social skills. They are not able to move in the society, they are not able to make the friends, they are not able to do the social interaction, and this is quite common in ADHD, even in the childhood period and even in the adults also. You can see so many adults are also with ADHD, so they are isolated. Okay, they very rarely get exposed to the society because they have problem in social interaction. Now, child with attention problem have difficulties in processing the verbal and non-verbal language, so which negatively affects the social interaction. Actually, what is happening is a child with the attention problem, ADHD, one of the problem is attention problem. So because of lack of attention, the child is not able to process the verbal and non-verbal language. Okay, so what is told by others, spoken by others, the child is not able to uh, decode it because he is not able to pay the attention to that. Okay, so he is not able to decode it, and the verbal and non-verbal communication, so he is not able to decode it, and as a result he will have a problem in the social interaction. So once this happens, then child withdraw himself from the society. Okay, so they are lag behind during the conversation and miss the social cues, and also trouble in learning the social skills. So this is the basic problem will be there in case of a ADHD. Now, difficulty in managing the anger is more common in ADHD. This is one more problem. A child with the ADHD, he will have a lot of problem in controlling the anger or managing the anger. Of course, every child will have the anger. Okay, Rushitam, Ruditam. So Kashyapa very clearly says these are the basic properties of the growing child. It should be there under physiological limits. But when it is, but those childs get controlled, able to control their anger when the needed things are provided, or mother start pampering the child, so they are controlled. But in case of ADHD child, it's very difficult to control the anger by any method. Okay, so there may be also problem in the handwriting, and there is also problem related to speech and language and motor development. Now, the speech problem which is existing here is not because of any problems. Again, in the speech, there is a requirement of attention. Coordination is required, attention is required, communication is required. So now child is having problem in attention, and he is not able to do all these things, all these highly coordinated things in a very neat way. So therefore, it exists or develop as a language problem or speech problem. The presentation of ADHD may differ as per the age in which we brought to the OPD. Now, this is very important. At what particular age the parents have brought the child to OPD, and now we have to look into the presentation. Again, that's what I'm telling. We should not jump into the diagnosis of ADHD. It depends upon many things. Sometimes it is a normal behavior. Sometimes it is simply the lack of attention. Sometimes there is only hypersensitivity, hyper reactivity. Now, age-wise also, this type of activity will going to differ. Suppose a child was brought to you or you brought to your OPD in the preschool age, maybe in the second year, third year, and fourth year, preschool age. Usually in the preschool age, the child with the ADHD will show the hyperreactivity and impulsivity, and also he is not flexible, and he may be aggressive with the peers. So this is the most common presentation when the child is brought in the preschool age. Okay, so attention part is not able to identify exactly whether the child is able to give the attention to a particular aspect or not. It's quite difficult in the preschool age. But these things are more predominant, like hyperactivity, impulsivity, lack of flexibility. Okay, flexibility means he wants that particular situation only, and he cannot adjust in another situation. Okay, so when the child is brought in the elementary school, that is a school age, after 5 years, 5, 6, 7, 8, 9, etc., with the ADHD, the presentation is completely different. In that time, child is struggling with the listening in the school. Okay, he has got a lot of scholastic problems, and he's not able to he's not able to concentrate on teaching. He's not able to write. He's not able to speak. Okay, and there is poor organization of the skill, and then struggle with the social interaction with the other kids, and difficulty in functioning independently. Somebody teacher has to continuously pay attention towards him. Independently, he cannot do anything. If the teacher is keep on telling him do, he can do it. Otherwise, in each step he will miss. Teacher has to tell him in each and every step, then only he will complete the work. So such type of problems are commonly seen in the ADHD child during the elementary school levels. Okay, so clinically I'm telling, when the mother may come with the different complaints. Okay, so age-wise we have to identify. In the adolescence period, suppose a child comes to you, mother brought the adolescence boy to you, then the main problems will be academic demands becomes overwhelming and struggle with attention, learning, and executive function. Now, adolescence period is a period of temperament, aggression, etc. Now here, when all the fellow members are doing very well in respect to their skill, learning ability, giving attention, concentration, etc. This child with the ADHD will have more problem with that. So age-wise, when the patient is coming to you, the presentation will going to differ. So this point we have to identify. Adolescence girl, adolescence boy, you cannot expect those features of the preschool age. In the preschool age, hyperreactivity, impulsivity, that will be more. But in the adolescence period, that may be less. That may be less, but he will have problem more with the learning and paying attention and executing the function, etc. Okay, so this is one of the very important aspects. Now, ADHD is an incessant restlessness and extremely poor attention span, leading in turn to an impulsive and disorganized behavior. So you can define, if you want, like this: it's a restlessness, stage of restlessness and extremely poor attention span, leading in turn with the impulsive and disorganized behavior. So this is quite common in the boys, as we know that 30 to 40% are involved with the comorbid conduct disorders. Now this is very important. This is very important. As I told earlier, common in the boys, 30 to 40% are affected. In ADHD child, about 30 to 40% are involved with the comorbid conduct disorders. Now, conduct disorders and ADHD, they are highly confusing. Okay, conduct disorder means its behavior is not proper, or it may not be trained properly, whatever you say. And ADHD is a hyperreactivity is there, inattention will be there, and impulsive will be there. Most of the time, these two confuse too much. So it's very important to differentiate before labeling any disease as ADHD. It is very important to differentiate it from the conduct disorders. We will see that. Now, in ADHD, usually there will be peer problems in the classroom, or intrusive, annoying, and distracting others. He is disturbing others, distracting others. He is annoying others. Okay, and he is disturbing the whole environment. So they cannot wait for their turn. That's the basic problem. Because they don't have the attention, they cannot pay the attention. They have got the impulsivity. So they cannot wait for their turn. So in a classroom setting, they have to wait for their turn, isn't it? Even in the society also. But they cannot wait for their turn. So they just start thinking and they want it. In the next moment, they shift to another matter. And again, they want it immediately. So this is a problem. So they cannot wait for their turn while reading or playing or eating, and thus they disturbs the class, and also they will have very few friends, or there is no friends at all, and they are very easily disturbed. So now this is a very important thing. The main differential diagnosis of the ADHD is with the conduct disorders. So this part of ADHD that we will discuss in the next class. For today, we will stop here. Thank you very much for listening me. And please don't forget to subscribe my channel, and also please give your valuable comments. So differential diagnosis of ADHD that we will discuss in the next class. Thank you very much. And we will meet